Back to Harbaugh, it might be one of the greatest ironies of the 2012 presidential election. The politician who has been one of the strongest and most persuasive advocates for the controversial individual mandate in health care is not the President of the United States, but rather his very likely Republican opponent. Mitt Romney put in place a law in Massachusetts that became the role model for the president's own law. But he's now one of the biggest critics of what's called Obamacare, at least by his critics. Jonathan Gruber is a professor. He's uniquely positioned to discuss the similarities and differences between the two plans. He advised both Mitt Romney and President Obama on their health care laws. He's a professor at MIT and author of the book Healthcare Reform. And Howard Fineman is editorial director of the Huffington Post and an MSNBC political analyst. Gentlemen, thank you for joining us. Professor Gruber, in any terms, layman's or experts, is there any big difference between what Romney did up in Massachusetts and what the president has done through his law nationwide?
Chris, there's not really a meaningful difference in the core of the plans. The basis of the national plan is what we did in Massachusetts. Both just in how it's structured, you can see that it's the same structure. And in the development of it, I can testify that I was asked constantly, how'd you do it in Massachusetts? How did you make it work in Massachusetts? Now, the federal law is more ambitious in two ways. First of all, in Massachusetts, Mitt Romney had a nice leg up because the feds paid for his bill. The federal government doesn't have that leg up. Second of all, our bill in Massachusetts did not try to take on cost control, which the Affordable Care Act does. So you can really think of the Affordable Care Act as Romney's plan for Massachusetts with these two extra parts.
And it has to have cost control to make up for the fact that it didn't have a revenue stream. Howard, it seems to me that, let me get one more question here. This difference, what is the fight about then? Is it just purely politics, Professor? There is no substantive difference between what Romney wanted to do. Tell people, look, as he put it, 92% of the people in Massachusetts have health care insurance. The other 8 don't. I'm going to make sure the other 8 get it.
You know, you don't have to listen to my opinion. Just do the logic on this. This is a Republican idea. It was originally developed by conservative economists, and at the bill signing in 2006, so Mitt Romney proudly signed this law into place. On the podium was a speaker from a Heritage Foundation talking about what a great conservative law this was. All of a sudden, President Obama, being pragmatic and smart about it, decides this is a good idea, let's adopt that, and suddenly it's the devil's work. I don't see how that could be anything but pure partisan politics.
You know, Howard, it reminds me of the old song from the 30s, you say neither, I say neither. A distinction without a difference. Anytime Obama calls for a tax cut on payroll tax deduction or anything like that, it's called no good. The Republicans think of it, it's a great idea. The same exact proposal. Is this what's going on here? You guys did it first, so we're going to dump on you for it. We're going to try to declare it unconstitutional, even though it's a conservative provision.
Well, sure, and here's 4 pages of talking points from the Romney campaign about Obamacare. It doesn't mention at all the word mandate. In other words, Mitt Romney's totally glossing over the fact that the conceptual core of his plan and the president's plan is to require everybody to have insurance. It doesn't work, it doesn't pencil unless you require healthy, mostly younger people to take part and spread the costs. It doesn't work. So conceptually they're the same, as the professor said, but Mitt Romney doesn't want to mention that, and his talking points don't mention it. Instead, the Romney talking points focus on the cost control part. They focus on this alleged huge bureaucracy that's going to spend a lot of money, etc. Because Mitt Romney doesn't want to admit that it was his plan and his advisors who generated the whole thing. And ironically, President Obama, back when he was a candidate, was against the individual mandate for the same neither, tomato reason.
You're right. He was against it. Hillary was for it.
Hillary was for it. So yeah, it's another case of tomato politics, only this time between the parties instead of within a party.
Professor and Howard, for our own gratification, here's the President of the United States now defending in court what he attacked as a candidate back in 2008. Let's watch him. Here's part of his argument.
If a mandate was the solution, we could try that to solve homelessness by mandating everybody buy a house. The reason they don't have a house is they don't have the money. And so our focus has been on reducing costs, making it available. I am confident that if people have a chance to buy high-quality health care that is affordable, they will do so.
You know, I was thinking about, a broken clock is right twice a day, I like to tell you. You're never always right. The guy who's always wrong is sometimes right. Santorum, for example, says Romney's the worst candidate to run against the president on the issue of health care because he invented it. Do you think Obama made a mistake by putting racing stripes on the same vehicle that came here from Massachusetts and made it look juicier and more exciting than it was? Make it more left-wing, in fact, than it was? Professor?
Well, look, I think what President Obama did, as he's done many times in his presidency, is do the right thing for policy reasons, even if it's not necessarily the right thing for political reasons. We've seen this a number of times of challenges he's taken on. He saw that it worked. That's the thing. When we do major changes in government, we rarely have the chance to run the experiment first. In this case, we did. We ran the experiment in Massachusetts. We've covered 2/3 of our uninsured. We've fixed a broken insurance market and cut premiums for individuals in half. For people who don't have employer-sponsored insurance, premiums have fallen in half. President Obama looked at that, said this worked. I think I was wrong. I think the mandate's the way to go, and let's go ahead and adopt that. I think he should earn praise for doing what's right, even if it wasn't necessarily what's politics.
Well, he also did it for two other reasons, Chris. I think one of them was personal, and political, in that a key moment in the Obama presidential campaign, if not the pivotal moment, was when Senator Ted Kennedy of Massachusetts endorsed Barack Obama.
Sure was.
And implicit in that was the promise, which the president carried out, Barack Obama carried out as president, to push for health care reform. And this was the chosen path. Don't forget that the president eschewed, to the dismay of a lot of progressives in his own party, a so-called single-payer plan that would basically be an extension of Medicare. The president said no. He was going to go a more market-oriented, compromise route. The route that Ted Kennedy himself had come to accept. Don't forget, Ted Kennedy had spent his whole career arguing for national health insurance, and this is the result of that.
Professor Gruber, I've got a curveball for you from the left field, all right? I'm mixing my metaphors here. If the Supreme Court strikes, I want Howard to follow up here. If the Supreme Court strikes down the individual mandate today, which is the most conservative way to have national health for everybody, requiring people to take responsibility as individuals, if that fails and the progressive left of the Democratic Party says no, now's our chance to go for either a single payer or what's called the public option. I guess it will end up being the same thing because there won't be another option really. Is that a better economic proposition, that the government simply provides health insurance for the country? Single payer.
Chris,
is that a better economic deal with no profit motive?
I think that single payer, if you could start over, I think single payer is a lot to recommend it, but we can't. And I think the bottom line is,
but we might have to start over after tonight. I mean, after this ruling.
No, I agree, but if we start over, it's the problem with failing. If this ruling goes against, this law fails, we'll see the same pattern we've seen for the past century, which is when we start over again, which will on average be about 17 years from now, because it's about every 17 years we start over, it's going to be further to the right of where we are. Every 17 years, remember Richard Nixon proposed something to the left of the Affordable Care Act. Every 17 years we moved. Every 17 years we move to the right. If this fails, the next round is not going to be single payer. It's going to be even more conservative than what we have now.
Howard, what happens if this goes down and say June of this year we get a ruling from the Supreme Court declaring the heart of the president's health care plan unconstitutional?
Well, I think basically the president's in a lose-lose political situation here. I think if the law is upheld, it will redouble the fury of the Republican right, which will use this as their rallying cry to say, there's only one way to change this law. The Supreme Court didn't do it. We've got to change presidents to do it. And I think that would redound to the Republicans' benefit. I think if the law goes down, if the Supreme Court strikes it down, it'll be a sign of futility on the president's part. The fact that he spent a year and a half or 2 years and all his political capital trying to get a bill passed that was found to be constitutionally flawed. It's unpopular politically. If you look at the polls, it's just not popular. And he's not going to spend the next July, August, September, and October arguing against the Supreme Court if the Supreme Court tears it down. It's a tough position for the president to be in. He might have done it for all the right reasons, policy-wise and in terms of his relationship with Ted Kennedy, but politically it's very, very tough.
You're dead wrong, Howard. It's a win-win for the president. I'm sorry, that's the way everybody talks today. You're probably right, Howard. Unfortunately, I was just going to do the usual thing where you disagree with everybody. Anyway, thank you, Howard. It was a sad commentary, but probably a very accurate one. Professor Gruber, thanks so much. Jonathan Gruber from the best economics department in the country, MIT, and everybody knows